Welcome to the latest edition of Immunology and Dermatology Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. Novartis has signed an up to $5.7 billion immunology licensing deal with Monte Rosa Therapeutics, including $120 million upfront and options on 2 additional early programs. The collaboration centers on AI-enabled molecular glue, degraders from the Queen platform, and marks their second tie-up following the 2024 MRT 6160 Pact, signaling continued investment in novel modalities. Rocatinlimab, the anti-OX40 antibody from Amgen and Kyowa Kirin, delivered a long-term update from Ascend. In this Phase 3 program focused on long-term safety with Q4-week and Q8-week dosing, adult prior responders who were re-randomized largely maintained improvements in skin, itch and overall severity at 1 year, with low discontinuations due to adverse events. Full data are pending. Amlitelimab, Sanofi's anti-OX40L, met co-primary endpoints in the global, randomized, double-blind, placebo-controlled COAST-1 Phase 3 study of 601 patients aged 12 and older. Subcutaneous 250 milligrams every 4 weeks and every 12 weeks achieved vIGA 0 or 1 in 26.5% and 29.1% versus 10.5% on placebo at week 24, and EASI 75 in 46% and 50.3% respectively, with a generally favorable safety profile, underscoring the appeal of less frequent dosing. Icotrokinra, Johnson & Johnson and Protagonist's once-daily oral interleukin-23 receptor-blocking peptide bested BMS's TYK2 inhibitor deucravacitinib in 2 head-to-head Phase 3 trials at week 16 and 24 on IGA 0 or 1 and PASI 90 and 100, with 52-week maintenance favoring continued Icotrokinra. Johnson & Johnson has filed for EMA approval of Icotrokinra for moderate to severe plaque psoriasis in adults and adolescents. Submission is supported by data from 4 Phase 3 iconic trials that showed significant skin clearance, superiority to deucravacitinib, and a favorable safety profile in a once-daily tablet. Bimekizumab, UCB's interleukin-17A and interleukin-17F inhibitor, showed durability in open-label extension analyses. Among week 16 PASI 0 responders entering the extension, 48.9% maintained PASI 0 at every visit through year 4, nail clearance reached approximately 82% mNAPSI 0 at year 3, and psoriatic arthritis symptom measures were low in a high-risk subgroup, reinforcing long-horizon value. Galderma launched Cetaphil Skin Activator, a consumer AHA, and encapsulated CICA firming line, citing early in-use improvements in crepiness and texture between 1 and 4 weeks and consumer-reported benefits, reflecting the blurring line between medical and retail skincare and potential synergies with teledermatology. Pfizer's ritlecitinib, approved as Litfolo for alopecia areata, delivered 3-year durability data. About 90% of month 12 responders retained benefit through months 36 to 38. 65.1% had SALT scores of 20 or less on observed analyses, and roughly 30% achieved SALT equals 0, with safety consistent over time. Stay ahead in immunology and dermatology research. Like, share and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.